All right, everybody. Thank you very much for joining. We are going to go ahead and get started right on time at 10 a.m. Central here. So I wanted to thank everybody for joining us for our latest webinar. Super excited, obviously, to have Dr. Dave Dudley here, and super excited to have such a diverse audience of doctors, of GPs, of lab owners, of all sorts of people across this dentistry industry. So we're excited to have everybody, and we're super excited to talk about flexible partial dentures today. And so, obviously, my name is Ethan. I'm a marketing specialist here at LuxCreo. You may have seen me around our social media, and just a quick, shameless plug. If you don't follow our social media, I highly suggest it. It's unorthodox, it's fun, it's super informative. I think a lot of the followers can attest to the fact that it's fun. So yeah, with that shameless plug out of the way, again, wanted to thank you for joining our webinar. There's going to be a Q&A session at the end of the webinar, so make sure to stick around for that, as well as a special promotion that we're running just for joining this webinar. For a week, there's going to be a discount on our FPD resin in pink and in clear, as well as the rodent teeth resin. So we are super excited to be able to offer that. And LuxCreo's FPD, we think is, the best in the industry, obviously. The same day delivery is huge. The strength and flexibility is huge. On our social media, we have videos where we're running over it with cars, we're hitting it with hammers, we're having people do tongue twisters in it. And, it's really authentic and really shows not only the quality and the strength and the flexibility of this product, but also the aesthetic and realistic aspect of it. So, you can see here just that little one, that little single flipper, little single tooth there. Uh, and of course, on the left, just a quick little graph to explain how different it is from the traditional laboratory aspect that has so many tedious aspects. So, obviously, I'll let Dr. Dudley introduce himself, but you can see a little bit about him here. Super talented, great guy. And today, Dr. Dudley is going to do a little deep dive. He's going to demystify the entire workflow, which is really what I think is cool about this webinar. So you're going to see the advantages of going in-house. You're going to see the results of that, the increased control. You're going to see the cost savings from that. You're going to see designing for perfect treatment. You're going to learn when it's appropriate to come in-house, when you should be outsourcing. You're going to see real applications. And of course, you're going to see how to get started. So, of course, write your questions throughout the webinar in the Q&A. You can submit them at any time. We'll do our best to answer them throughout the webinar or at the end. And of course, if we can't get to them, we'll be sure to follow up with you after the webinar. So without further ado, I'm going to introduce Dr. Dudley and just let him take it away.
All right. Hey guys, I'm gonna go everything that we need to know to get started with this new flexible partial denture resin, and show you how it can help everybody out. So a little bit about me. I'm a solo dentist. I've got my own practice for about 7 years now. We're about 65, 35 PPO to fee for service ratio, just so you kind of get an idea of my working environment. I really pride myself in doing quality dentistry, done comfortably for patients, but also efficiently. And that's a benefit for patients and the practice, especially if you all know taking PPOs, really important to be efficient with our time and mindful of our overhead. I've been leveraging digital dentistry and 3D printing in particular, really been huge benefit to the practice. It allows me to be more efficient, but also increase the quality of the work, just because we kind of have more control over the dentistry that we do. I really love doing dentistry, but I do not enjoy being stressed out. There are so many aspects of dentistry that we don't have any control over. So anything that we can add to the toolbox to gain some control, reduce costs, reduce stress for me and the patient, is just a huge win. And now, not to stress anybody out, but you have an emergency patient show up looking like this. You got a broken tooth to the gum line, crown, and half a tooth and a little baggy, and they're expecting it to be re-cemented and be sent on their way. It's got a root canal, it's got a post. The patient has a wedding or birthday or vacation in a few days, and I know everybody here knows that story. This is the definition of stress in the dental office. So, what are our options here? We can do a gingivectomy, crown lengthening, larger post, new crown. We can tell the patient to not eat carrots. We can pray to the dental gods, and you let us know when things break again. This case here was just a couple weeks ago, and it wasn't awful, so we kind of went for it. But we all know those cases that if we tried to do something like this, they wouldn't even make it to the parking lot. So other options we can extract and temporize. And what are our options for that? We can do a Maryland bridge. We can just re-cement this broken crown and see how long we get out of it. We can ask them to wear a mask, which was really great during COVID. It really took the stress off. And say, here, wear this, and nobody will even see. You can make a flipper of some kind. And if you decide to make a flipper, what I would do is I could have an acrylic flipper made just by a local lab in a few days, and that's with kind of rushing them. It's not going to be great. It'll may break if the patient drops it in the sink, may break if they look at it sideways. I really don't like those things, especially when you have somebody rush to make one. They're just not great. Um, Valplast flexible partials are a great option, but usually take a couple weeks at a lab. So what I used to do was tell the patient, if you need something quickly, we can make a subpar acrylic partial in a few days if we're lucky. If we want something done well, we need to wait a couple weeks. So several times I would send a scan or impression to both labs on the same day. We pay the local lab to make something fast, another lab to make something better. Now we paid twice, and we're still kind of just stuck with a temporary solution, and that's best case scenario. Try and give the patient as much information as possible to make a good decision, but we know all they're thinking about is, I can't walk around like this. How do I get to work tomorrow? And it's hard because you just can't promise anything to them. And now this kind of appointment doesn't even raise my blood pressure. I can confidently tell patients, whatever you decide, I promise you're not going to go a single full day without a front tooth. And now that the patient's calm, they can think straight, you're already a hero at that point. So instead of everybody stressing out about how to get a temporary, now we can focus on, what is our long-term solution and goal going to be for whatever happened. And this is kind of the magic of digital dentistry, and being able to do a flipper in just a single day. And 3D printing, in general, when it comes to retainers, models, night guards, it can be done in an hour or so, and that's all great. But a flexible partial denture in the same day will probably actually improve my quality of life. Um, Printing flippers, partials probably isn't going to make anybody rich, but it will help you sleep at night. So we've got three steps to this whole process. The first step is the design. Either you can design this yourself with different types of software programs. ExoCAD's the big one, Blue Sky Bio, 3Shape. I'm sure there's other ones out there. Or if you don't want to be that hands-on, you can outsource the design. Evident is a digital lab that's partnership with LuxCreo, and they made case submission really easy for that. You can get design back in just a few hours. Most modern labs will have some sort of design service. So if you're happy with a lab that you use, you can just ask them what the cost and turnaround time for an STL file for the partial denture. And there are a lot of freelance designers, which can really get a design back pretty quickly for you. The second step is the print. Generally takes about an hour to print these. LuxCreo has the one-click AI nesting application inside that really removes a lot of the hassle and of the workflow and avoiding misprints. The third step is post-processing. And typically with 3D printing dentures, you tack cure the teeth to the base and then you cure them together. And this is a little different. It's not something you need to memorize or write down. LuxCreo has a whole sheet that really kind of spells this out pretty well. But what you're going to want to do is wash the base and then do a full cure of that. You don't want to take off any of the supports until after it's fully cured. Then it's stable, won't deform, and you can kind of work with it and not worry about it. And then you print the tooth separately, obviously because you're using different resin. And then you tack cure the tooth to the fully cured base. And then you cure that based on what the tooth resin is. And I usually use Titan for the teeth, but this workflow really allows you to use any tooth resin that you want. Since that base is already cured, that second cure is whatever the tooth requires for the curing of them. When you tack cure these together, you can either use native resin, or you can use something like the rodent glaze, which I like to do because it's just kind of really easy to work with. Polishing, these things really look great right out of the printer, so you can just polish off the supports, or you can add the rodent N2 free glaze, which I like to do. It kind of just makes it look like glass, which is great. I can design these in probably 15 to 20 minutes. Most designers can probably do it in 5 to 10 minutes. Takes an hour to print, hour to wash and cure, 15 minutes for post-processing. So really in under 3 hours, you can kind of save the day with something like this. So new patient walks in, acrylic partial broken in several pieces, which is a big shocker, and they are leaving town tomorrow. So I am not calling in a favor to a lab. I'm not canceling my next patient to try and acrylic patch this old partial back together. But what I'm also not doing is stressing out about this. I can just tell the patient, we can have you a new one by the end of the day. So just come on back. And something like this, you'll have a patient for life. You'll have a cheerleader for your practice. And what was an emergency just kind of turned into an opportunity. So a little bit about the actual resin and some of the properties. It has a great ability to flex, and this is kind of a cool video showing it flexing. See if I can get that to work there. And it's always kind of fun showing these to patients. You know, these are flexible, these are comfortable, but we don't actually want the whole partial to flex. We want to be able to control where and how it flexes. Flexible partials in general kind of get a bad name because they can damage tissue, they can dislodge easily. They just don't provide a ton of support for chewing. I'll show you how to fix that, and a lot of it comes with the design and the situation that we're in. Another great property of the resin is its thermal retention after it's been cured, and its ability to retain or really kind of regain its shape. And gone are the days of our partial denture touching a countertop and just shattering. So, it can be tied in a knot, run over with a car, whatever people manage to do to these things. And then you just add hot water and these things will just bounce right back. And that is just awesome. Um, Stain resistance. This is a big one, and this kind of really dictates how long these things are going to last. All flexible partials will pick up some sort of stain over time. I was actually using the DCA retainer resin for over a year for doing this sort of thing, which is not really what it was made for, but it helped out in a pinch. But the problem is it picked up stain really fast. But these are so easy to print that I would just print out a couple extra and just give them to the patient. But this new FPD resin really is a step up in the stain resistance. So I did some tests here, and that's just kind of what I do. I took one and just polished off the supports. Another one, I put the Rodin N2 free glaze on it. I put both of them in Diet Coke for a week and didn't see any staining on either of them. And so I got excited for that, and I was trying to come up what's the hardest test I could think of. So I threw them in hot coffee and just left them for a few days. The one that was just out of the printer did pick up a little color, and that's that lower one on the left. It's still tissue colored, but there was a slight change. So, in my head, if a patient's gargling with coffee for 72 hours straight, you might see some discoloration on something. But if they're cleaning this every day, obviously you're not going to get to that point. The glazed partial on the right really didn't show any stain after sitting in coffee for a few days. So I got really excited just at the potential for the longevity of some of this. Um, Cleaning instructions for patients. I actually give a little, I add an ultrasonic pod to the patient's treatment plan for most of the removables that I do. And that's kind of just peace of mind for me that they're going to actually clean these. Dawn dish soap works well with a toothbrush, also Polydent denture cleaner. So how long are these things going to last? It's a newer resin, and at this point, we're 6 months really without an issue. So I'm hoping for some long-term use out of these. Now, Valplast partials are typically what I've used, and it's kind of the standard for a flexible partial. So I just wanted to compare the two. Valplast partials are obviously hard to adjust if you guys have done that. They're nylon based, they fray easily. You've got to use a special burr, you've got to do slow speed. At the end, you're using a scalpel doing surgery, trying to get all the little, the little fray things and nylon pieces off of it. The FPD resin is just a 3D printed material. It's super easy to adjust. You don't need anything really special for it. The Valplast from labs, I've 200, or I've had labs, ask for over $400 for these things. The FPD resin, so the material, when I calculated the weight of these, it's about $7 of material, which is great. And then, so depending on how you design this, if you have somebody else design it, you're delegating to staff. One of these is anywhere from $25 to $90. And then if you have to reprint for whatever reason, obviously we just got $7 of material instead of, $200 to $400 by having a lab work on it. The Valplast partials really don't bond well to teeth. And I'm sure if you've used these before, teeth have popped off. I tell patients, this is a piece of plastic. You got to be careful, and kind of leave it at that. With the FPD resin, the base really chemically bonds to the teeth and is really strong. I had put the wrong shade in a base once, and I thought, well, let me just see how strong this is, and they're easy to reprint, but let me see if I could pop this thing off. And I actually ripped the partial by trying to get the tooth out. So at this point, I'm just going to tell patients, just have at it. Don't worry about it. Valplast obviously will pick up some stain over time. Initial test with this FPD resin is really showing some good stain resistance. So it's been great so far. Take a screenshot of this slide. If you are new to 3D printing, here's just some stuff that can help you out. The acrylic polishing wheel from Comet on that upper left is great for removing all the little support nubs, and it's kind of like a pre-polish and works great for adjusting these. The polishing buffs on the lower left from Brasseler. I hate working with polishing paste. It just kind of gets everywhere. It's a mess. These are impregnated with polishing paste and are fantastic. They've got a medium orange it makes everything super smooth, and then that pink is kind of the fine buff. And those with just a normal generic acrylic burr are all I need. If you don't have one in your lab, get a dust collector. These are super cheap. Ton of vendors have these. Really just kind of helps keep things clean, so you're not breathing in all this stuff. When it comes to tack curing the teeth to the base, you have to have a specific wavelength for that to work, and that's 385. Not all curing lights are that wavelength. I've got 3M curing lights, and they just won't work for this because they're a higher wavelength. There's, I think, the blue phase curing lights. They are the correct one, but I don't want to spend $2,000 on a curing light just to tack cure this stuff. So Amazon, $30. This is called the UV Beast. It's got the right wavelength and it works great. If you're new to 3D printing or if you've done it for a while, you will either know or soon find out is an absolute mess. It can get everywhere. You kind of need an area for it. What works great are just restaurant trays from Amazon. Get a couple of these, use patient bibs, put them on top of this, and makes things so much easier. The FPD resin is super thick. You almost have to like squeeze it out into the vat. Um, so if you clean this up right after the print, because it's heated, is easy. But if this is left for a while, you're printing this overnight, once it's cooled and it's thick again, it's hard to clean up. So on the LuxCreo printer, if you go to the bottom of the front menu, there's quick operations at the bottom, and then you can hit just the to heat up the vat. So if you left this for a while, you can just heat up the vat for 10 minutes and then it's super easy to clean out. And because these are lasting longer now, I've been getting into more full arch partials with it. So I want to talk a little bit about some of the design stuff for this. So the design on the left is probably how most dentists would want to design this. You know, it's thin, it's unobtrusive, it looks comfortable, but this one's got a problem. That kind of thin horseshoe main connector will have a lot of flex. It's going to be less stable. You're going to put a lot of pressure on small surface area of the tissue, and you're probably not going to get much support for those posterior teeth. The design on the right should be more what you're kind of thinking of. And the idea is to get a more rigid connector, but a flexible clasp. And I'll have a slide with all the design parameters, but for the major connector, if you have that at 1.5 millimeters thick and 10 millimeters wide, it's going to be really stable and will, prevent that flexing during function. You can't get away with that size all the time, especially in the mandible, but it's kind of a good rule of thumb. Because we aren't drilling rest seats for flexible partials, it's a great idea to take advantage of natural rest seats when we can. And canines are a great option for this. So if you bring the base of the partial up over the cinglins of the canine, if there's room, now all of a sudden you've got a tooth supported partial in that area. So that can really help with the stability of this under load. And another way to add rigidity for this is adding a posterior strap. And that's going to make this function so much better, and patients going to be happier with that. So this is the design for that same case that I actually went with. It's just kind of a wide strap engaging the undercuts on the contralateral side. It allowed me to remove the bulk of those anterior teeth, but still keep some really good retention. So with these, don't be afraid to get creative and don't always leave it up to the person designing the partial. You look at the teeth and figure out where the undercuts are and what's going to be most comfortable for the patient. So here's that same case. That left photo is the day that I delivered it, and the one on the right is just over 3 months of wearing this every single day, and it still is looking brand new. The patient actually had a Valplast on the lower and told me that this one was more comfortable and smoother than the Valplast. So I am really excited for this. There are two different shades to the resin. We've got clear and pink, and it really just kind of comes down to personal preference. We're all used to using pink for partials, but you have a clasp on the anterior, and that's pink on the facial. It may look like that tooth is a little shorter, or it may stand out a little bit more. So clear is a good option if you're trying to get some more retention and do a facial clasp that might be visible. If you have a high lip line and you also have lingual undercuts, undercuts, the lingual only retention is a great option. You need to look closely at the teeth and scan to make sure that this will work. But if you have a low lip line, you can throw a clasp on that facial, and then you never have to worry about this thing dislodging at all. So here's another slide to take a screenshot of. This is just kind of general design parameters that seem to work really well. So keep these in mind either if you're designing yourself or if you have a lab do it. A lab has no idea what material you're using. So you give them some direction, you're going to get a lot better result. So you want to tell them what teeth you want clasp on, how thick you want different parts of the partial to be. You can give the same scan to 5 different designers and they may all come up with a different design. So I'm sure we're all looking for consistent results. So you should be giving some consistent instructions to them. So generally, the thickness of the partial, if we have that at a millimeter and a half, that's going to really prevent some of the flexing. If you're doing kind of a posterior distal extension, 2 millimeters thick around those teeth will provide a ton of support. The clasp, because those are the areas that we want to be flexible, if we thin those out to a millimeter, they're really going to be able to snap into the undercuts. But we also want those 3 millimeters wide because we can imagine these things are flexing all day, every day. So 3 millimeters wide of that clasp will really should allow the resilience for long term. Major connector, like I showed you before, 10 millimeters wide when possible. We know we have to get creative sometime in the mandible and it has to be a little bit thinner. Undercuts. So if you can find half millimeter, 0.7 millimeter for the primary retention, that is gonna snap in and be great. 0.3 millimeters for the lingual plating, or if you want some retention on some other side. Either if you or somebody else is designing this, sometimes you have to change the line of draw to try and control where the undercuts are. And if we remember back to dental school, there's several candidate classifications. But before we start cracking open our old textbooks and study cast partials and rest seats, a great resource for designing these partials based on different classifications. There's a free 50-page guide by the Mod Institute. This really is helpful in designing some of these cases and can walk you through every single step of the exocad process. And if you want even more than that, they have an online course just for flexible partials, which is great. Like most dental and lab work, if you put garbage in, you're getting garbage out. Scanning is super easy to delegate, but everyone needs to be on the same page for what we're looking for. The scan on the left, it shows the teeth, it shows what we're missing. This would give very little options for a partial design. You and your patient both are going to be frustrated with what comes out of this. You need to scan the palate to give you more room for the major connector. And if you end up doing a strap of some time, it gives you more options here. You also need to get the undercuts of the teeth, especially the distal teeth where clasps might go. This patient, where she's missing those teeth, has some serious tissue and bone undercuts. And if you're not careful, that partial, is going to pinch and it's going to rub. You're going to spend half an hour trying to figure out what's going on and adjust this thing. But if you stretch out all the movable tissue and kind of hold it there while you're scanning, now you can see exactly what's movable and what isn't. And that partial will just pop right in and you won't need any adjustment. So a couple extra minutes in scanning will save you a ton of time later on. So this is a typical case with just extraction and making a flipper beforehand, really predictable. And it's always nice to be able to tell the patient, you're never going to leave the office without a tooth. And a tip, if you're using Titan as the tooth resin and you're kind of in between shades, go with the lighter shade. Because what you can do is you can just throw this partial back in your curing oven for a few extra minutes. and it'll actually darken it. But you also need to think if you're using your that UV beast or tack curing this or and you're glazing this, you don't want to spend a lot of time with that light on because that will end up darkening it. So you really, when you're tack curing, you just want to be doing this for a few seconds. I learned that the hard way by, all right, I'm curing this, a ton. My A1 shade quickly turned into A7. So it's great because you can have control of it, but also you can mess up a partial that way. So this is a case where the patient was obviously putting off dental work, finally was in enough pain to force her to come in. She knows she needs a lot of work, extractions, and some other stuff. She's got loose teeth. She can't eat without being in pain. She's got abscesses in several areas and obviously some serious perio issues. I can't even think long term what might be the right option for her. Are we going to be doing implants, bridges, partials? I don't even know how the teeth are going to respond to perio treatment. Uh, she's just in too much pain to chew, but she's also terrified about walking around without teeth. So what I did was I just knocked off some of the calculus to at least see where the teeth end, the tissue begins. We virtually extracted the teeth that we knew were 100% needed to go. And then I made a partial for the day that we did some extractions. We just need to get her out of pain, remove some infection, and just start with some perio treatment to see where we ended up. So she's in a partial, going through perio treatment, and after a few months, tissue is looking a lot better. But number 24 was really mobile. It's not going to be much help for anything down the road. So normally, what would we do? Would we add a tooth to a partial? If it's acrylic, probably the only benefit of that. We're going to take the partial from her. It takes a few days to add the tooth. She may freak out that we're taking her teeth from her. If we've got a partial, that's really not going to work out too well. Since the tissues shrunk from the perio treatment and the extractions, any partial that we had previously made probably isn't going to fit too well. So we're going to charge her for a second partial. If she's got insurance, good luck getting help from them for a second temporary partial. Instead of dealing with all these headaches while the patient's in hygiene, I just said, take another scan. We'll make another flipper, see you're back in a couple days for the extraction. So theme here is just never letting patients leave the office without teeth. That was an easy design, just popped in the new partial after we extracted, and we'll continue perio treatment just to make sure everything's stable before we come up with the final solution. And the point of this was just that it gives me options during treatment. I don't have to coordinate with a lab, call in a favor, stress out about anything. So overhead for these. Like I said, it's about $7 for the resin, 10 to 15 minutes for the design, or you can have, somebody else design this for you. About half an hour of, delegating the post-processing. So depending on how you're designing, 25 to 90 bucks to have this done, versus just adding a tooth to a partial, maybe $200 or more, or have a lab make a new one. And there's this guy. He's missing his four front teeth for quite a while. Got financial issues, and he's just kind of trying to go about his day-to-day life without his front teeth. I knew this was going to be a long-term solution. So I wanted to make it blend in as good as I could. This is before I had pink resin. So I added rodent stain, so magenta and red, and tried to make that Meharry shade. I added gray and white to make a translucent incisal edge and some gingival warmth on the teeth for a little transition. And it's a great idea to take a photo even for yourself or a lab so you've got something to look at. More information is always going to give you a better result. A friend of mine who owns a lab and mainly does fix or implant work, but knew I was doing these and asked if I could print a flipper out for a dentist nearby, and they needed a flipper and they needed it quickly. I said, sure, no problem. Send me the scan, send me your lab slip. The lab slip said number 7 flipper, B1. It also said the patient is generally very emotional, already doesn't feel comfortable with having a tooth extracted, worried her husband's going to see her without a flipper. And this was officially my first and last day as a lab tech. That information doesn't help me out at all. I get it that you're stressed, the patient's stressed, but now I have to be stressed too. Yeah, no thanks. Uh, since these aren't generic teeth just pulled off a card, you know, these can be mirror copied in the software from the other side of the mouth. They can be characterized. These things can look great. So, public service announcement, be nice to your labs and your lab techs, give them more information and photos, and, they can do a great job. So back to this case, I was able to add, some facial clasps to really give this some great retention. If I got this level of detail back from the lab, I would be happy. And you can kind of see that partial blending into the tissue. And so for something like this, for under $10 in material that changes this guy's life immediately is amazing. So none of this is hard. And with this technology of 3D printing and these new resins, it's really allowing us to do some great things and give us control where we never used to have it. So that's it. Let's take some control back of these partial dentures, improve outcomes, and reduce everybody's stress. And that's
Thank
all
you
I got.
very much. Yeah, thank you very much, Dr. Dudley. Um, I'm going to replace the current screen share with a quick slide about the uh, FPD resin discount so you guys can get that FPD resin clear and pink, whichever you guys prefer, as well as the rodent teeth resin discount as well. So you can see that QR code here. Again, it is valid for a full week, and the promo code is FPD424. You can screenshot this. You can scan that QR code. But that was incredible. Thank you. It was super informative, Dr. Dudley. And we'll stick around for a few minutes just to see if anybody has any questions that they have put in the Q&A or in the chat.
There was a question in the chat for Dr. Dudley. What are the typical fees for these types of appliances? You did show and share that overhead slide. Are there any other fees or items that are associated with, or is that pretty straight up?
That's really it. I mean, so you've got fees that you're, charging patients, or you've got fees when you're making this. So if it's what our overhead is, it's the material cost. And then the other thing is really just how we're designing this. So if you're designing this yourself, obviously it's just the material cost and you're paying an assistant to do 30 minutes of post-processing. If you're having a lab make the design, it all depends on what that lab is charging. But like I looked up Evident and I think it was $65 for the design from them. And there may be, I think it's like a $25 expedited charge and you get this back in a couple hours. So the design is where the fees may change a little bit. But that slide kind of summed it up. So there shouldn't be any other hidden cost or anything.
Thank you. Another question that just came in: does anyone know of any hands-on training for design and printing?
So the Mod Institute, where they've got that free PDF, they're great for. They've got a whole online course that will walk you through specific cases, and you can actually get the files and you can practice yourself on those and go through them as they um, show you how to do it. So that's kind of where I learned how to design these. So that's a great resource.
Yeah, and I think from a printing perspective, you're always welcome to reach out to us at LuxCreo. Our customer success team stands ready to assist and walk you through the process. We also have our self-paced learning website called Lux Academy that you can get information in, as well as our online knowledge base. So hopefully that answers your question, Brittany. Got a couple more questions coming in. How long partial dentures FPD can last in a patient's mouth?
I wish I had the answer to that. This resin's been out for 6 months. So I've been using it the day that I got my hands on it, and it's been working great so far. That's where I was doing those tests, trying to beat these things up a little bit. So I'm not sure. And at this point, you cast partials work great when you need them, and this is kind of my other go-to, and we're going to see how long these things last. But so far, they've been working great. So I don't know if LuxCreo has any more data other than at this point, we're just going to hopefully see how long these things last.
Thank you, Dr. Dudley. And then there was another one about the scan and how the design and how much it is. I think just going back to what you had said, if you're doing it yourself using software, there's the software cost, and any of your time involved in doing the design, or if you're going to go out to a service, there will be a fee for that, a design service. We have our own design service in Lux Cloud where we've partnered with Evident. And I think Dr. Dudley's right. It's around $65 or $70 for a flexible partial denture design. And it's a really easy to use interface.
Greg, as I share my screen here, I don't have access to the chat, so I'm not sure if there are any more
Uh,
questions.
yep, I'm looking. There's no additional questions at the moment, but we can give another moment or two for them to come in. Um, uh, while we're waiting, Dr. Dudley, maybe I'll ask a question. You had mentioned before about choosing when to use the clear resin versus when to use the pink resin. What do you find yourself using more of day to day?
I've been using the pink just because as a dentist, it's just what we're kind of used to using. But the clear blends into the tissue, so there's no real reason to not use clear for, posterior partials. I haven't done a whole lot of testing when it comes to stain resistance over time. In my head, it's, well, if the clear does pick up some stain after, who knows, a couple years, maybe that's more noticeable than a pink one that picked up a little bit of stain. But not sure. And I'm sure I'm going to be kind of going back and forth and testing with both of them.
Thank you. And another quick question from me, not from anyone in the audience at the moment, but you had mentioned doing some characterization with additional UV light. Do you do any characterization with the Rodin characterization kit, or is all of your characterization just through UV?
Oh, so I use the Rodin palette stain kit. And so before that, the final cure, it's got, basically is like flowable composite stains. So you can characterize this as much as you want, and then you just tack cure that with that UV beast light just for a second, just to kind of solidify it, and then you throw the whole thing in the oven for that final cure.
Thank you. There is another question that's come in, probably one for me to answer. Lux Design gives STL file or Lux Flow for print. The We don't provide the design software for flexible partials. However, we do have our Lux Cloud service that you can use to have a design created by a person. Then the setup for the printer is through LuxFlow. So you would import the base into LuxFlow for printing with the FPD resin. You would import the tooth STL into LuxFlow to print in your tooth resin of choice. Dr. Dudley was talking about using Rodin Titan. And then you would slice those, send them to the printer separately, one for printing in the FPD resin and one for printing in the Rodin Titan resin. It looks like we have a few more. One was, doesn't the glaze come out with cleaning? I'm just curious to know.
So the rodent N2 free glaze is something that's been newer on the market with, I think it's not even been out a year yet. Um, so we're not sure how long this thing's gonna, hold up over years, but it really adds a, a great protective barrier. And I've used these on, 3D printed veneers and they're working great. So just cleaning these isn't going to just take that glaze off. It makes it more durable than just the resin itself. So I can't tell you, if you're using a stiff toothbrush and, you know, toothpaste, how long eventually it may wear off. I'm just not sure because it's kind of a newer product, but it seems to give a protective barrier to this.
Thank you, Dr. Dudley. And then we've got another question. What are your patient fees for these partials? Are they the same as Valplast?
Yeah, so obviously, if you're taking insurance, this can vary widely, but I'm charging the same as Valplast because I'm kind of backing this up that this is going to perform as well or better than Valplast. And like when I was doing the old retainer resin, the same thing. These things are so easy to reprint. So if I've got a patient 2 years from now that something happens to break, I will eat the $7 to make a new one because I still have all the files. So at this point, I'm charging the same because I'm kind of offering the same service to them.
Great, thank you. Pause here for another moment to see if anybody has any additional questions. Again, if you do want to check out LuxCloud, you can go to dental.luxcreo.com. That is our digital design service where you can get flexible partial denture designs, full denture designs, crown, veneer. Uh, um, uh, uh, you can get treatment plans done for aligners. Uh, we offer many different services through that online service.
Absolutely. So we'll stick around for another 30 seconds or so, another minute, see if there are any more questions that come in. Possibly another one just came in, I'm not sure.
Another one just came in. Can you repeat the online name? It is our Lux Cloud service, and it's located at dental.luxcreo.com. I'll put it in chat.
Yeah, if anybody here is going to be at AAO, stop by our booth 1775. We'll be doing a live software demo of LuxCloud. And we've got some cool new features on there that we're going to be showing off, like a AI diagnostic health report type of thing. It's pretty cool. So we're excited to see you all there. And if there are no further questions, I think we'll go ahead and end the webinar. But thank you very much, Dr. Dudley. That was super informative. And I think the workflow, at least for me, has been demystified.
Awesome. Happy to be here. Thanks for having me.
Thank you.
Thank you, Dr. Dudley.